Working in dentistry, there's a lot of different avenues dentists can do. They can just do the bread and butter. They can just do fillings and crowns, which is we call it the single tooth dentistry. My services, we do everything from white resin fillings, porcelain crowns, smile makeovers. Our specialty is full mouth rehab, the dental cripple. Can't eat, can't smile, have no confidence. We rebuild full mouth, whether it's need of implants or just crown and bridge. We can do all the bone graftings, extractions, root canals, so it's a one-stop shop. I think that everyone, if they do go through dental assisting, should plan on becoming an EFDA. It just broadens their horizons and their opportunities and what they're able to give to a practice too. I've had 3 students come out of the YTI program, and each one has had a good working knowledge of what's needed to be an EFDA. If I'm prepping a tooth for a crown or for a restoration, if I need to transition into a hygiene exam, it's great that they're able to hop in the chair to do all the band, the wedging, filling the teeth. They can do the whole curing. They know the system, so I can have more time with my hygiene patients, so it's a smoother transition in the office.